As nicotine pouches' popularity soars, a new study finds they're also responsible for more poisonings in young kids. Let's discuss with Dr. Matthew Tenenbaum, the Associate Medical Officer of Health in Wellington, Dufferin, Guelph. Great to see you. Thanks for being here.
Thanks for having me today.
So this is based on American research, and according to the U.S. Centers for Disease Control and Prevention, nicotine pouches have actually become the second most used nicotine product among young people. I want to talk about your concerns and what awareness this is flagging for public health officials.
Yeah, so nicotine pouches, they can be a great thing for people who have existing nicotine addiction. They can be, great alternatives to getting their nicotine through cigarettes and other tobacco products. For some people, these are really helpful ways to control nicotine addiction. Unfortunately, there are harms when people who don't actually need that nicotine use these things recreationally. We saw a lot of concern, including from ourselves, over the past couple of years as these began to be part of the market in Canada. Initially, they were very easy to access. There have since been some regulations to make them harder to access, but there's still things that people can access from pharmacies. There's still things that people might find in their home if they have a family member who uses them. And unfortunately, they are among the things that young people might try to experiment with and use even if they don't have an existing nicotine addiction.
Can you explain exactly what nicotine pouch poisoning is?
Sure. So nicotine pouches, they contain nicotine, which of course people are probably aware is an addictive chemical. The idea is for people who have a craving, an addiction, it can be helpful in managing that addiction. But for someone who doesn't have an addiction, if they put that nicotine pouch in their mouth, they're still getting that nicotine coming out into their mouth, being absorbed in their body. And that of course has impacts on different systems in their body. It can make them feel nauseous, make them have dizziness or headaches, make them feel unwell. And of course, in larger quantities, we are concerned about things like significant impacts on the heart and the lungs. There have been cases of people who have had to go to hospital, including the ICU, because of high levels of nicotine they were exposed to from these pouches. And unfortunately, young people are a particular risk because they're smaller, their bodies work differently, and the amount of nicotine that a pouch contains is greater proportionally for someone who's small and young.
Yeah, and we're talking about poisoning in small young kids. So what are some of the early on symptoms that parents or caregivers should be aware of if their child is facing nicotine poisoning? Just those early symptoms to watch for.
So key things early on that might appear is nausea, vomiting, stomach upset. If your kid is old enough to be able to communicate this, they might tell you that they're feeling tired or dizzy or that they have a headache. And they might also appear pale to you. Again, depending on the age of the kid, they might be able to tell you this or not, but they will appear unwell, and it won't be obvious that it's nicotine because it'll mimic other kinds of illnesses they could have.
If parents maybe suspect their kids are using these types of pouches, how can they stay a bit more vigilant, or what should they watch for in their kids' behavior?
So I guess the key thing is if you are, a family that has these pouches in the home, because, for example, someone is trying to quit their habit of smoking cigarettes, it's important to keep these things, secure, locked up, just like any other pharmaceutical that you'd have, and not make them easily accessible, because that is how it can end up in the hands of young people who are curious and want to try it with their friends. So that's thing number one that parents and families can do. And it is important as part of, your child or teen's development to try and have ongoing conversations with them about what kinds of things they're interested in trying or curious about, what kinds of things they're seeing their friends doing or using when they're at parties or social events. It isn't just about nicotine pouches, because, there are other things like cough syrups and different kinds of substances that kids use when they're with their friends as well. This is just one extra thing that parents may not be thinking about that they can ask their kids about. But ideally, it's part of an ongoing conversation about what their child is curious about and thinking about, and what attitudes they have towards things like nicotine pouches and other substances that they're exposed to.
Yeah, I think that's a good point to bring up as well. Great topic, great chat. Dr. Tenenbaum, thank you so much for your time. Dr. Matthew Tenenbaum is the Associate Medical Officer of Health in Wellington, Dufferin, Guelph. Thanks again.
Thank you very much.